Realize.
Hi, hello, and a very good evening to iFocus Online, lecture number 432. So today we have the second lecture for Toolkit for Residents. So we have with us Dr. Sabyasachi Sengupta to speak on the topic Thesis Therapy, Turning the Research Mess into Magic. A brief introduction about Dr. Sunny, who is belovedly called so. So he did his diploma in ophthalmology from JIPMA, my alma mater as well. And further, he did his DNB from Arvind Pondicherry, and then research and clinical fellowship in vitreoretina from Shankar Netralia. And he pursued his research fellowship at Vermeer Eye Institute, Johns Hopkins, United States. Currently, he is working as the vitreoretinal surgeon at Future Vision Eye Care, Mumbai. And to name a very few, he is ex-associate editor of Indian Journal of Ophthalmology from 2017 to 2023. He has been awarded the McCartney Prize by the Royal College of Ophthalmologists in London in 2010, and he's the first ever non-British national to receive this award. He has published over 100 plus papers in index peer-reviewed journals, and he is included in the top 2% of global researchers list by Stanford University for 2021. The founder of Sengupta's Research Academy, a one-of-its-kind portal offering the e-lectures on research methodology and services for manuscript preparation. We welcome you, sir. We are very honored to have you on iFocus Online today. Over to you.
Thank you so much, Farnaz. And all right, let's get going. Okay, let's not just talk about a thesis. That's, of course, the primary focus of today. But, let's talk a little bit more in general in terms of, research. Remember that thesis writing is the first step towards actually becoming a clinician scientist, or rather a researcher. Just 1 second. Yeah, right. So the first step of becoming a researcher is to become do your thesis well and then finally get it published. And then that should be used as a stepping stone. So what do you think when you think about research is, is what I ask a lot of people, even in live sessions. I mean, in like in-person sessions. So I'm going to show you a quick video clip from a film. So don't think about which film it's from, though it's very obvious. Think about the message, and then we'll go ahead.
दिलों में तुम अपनी बेताबियां लेके चल रहे हो तो जिंदा हो तुम। नजर में ख्वाबों की बिजलियां लेके चल रहे हो तो जिंदा हो तुम। हवा के झोंकों के जैसे आजाद रहना सीखो। तुम एक दरिया के जैसे लहरों में बहना सीखो। हर एक लम्हे से तुम मिलो खोले अपनी बाहें। हर एक पल एक नया समा देखे ये निगाहें। जो अपनी आंखों में हैरानियां लेके चल रहे हो तो जिंदा हो तुम। दिलों में तुम अपनी बेताबियां लेके चल रहे हो तो जिंदा हो तुम।
Yes, I think as residents, it's really important to have this eagerness, and not just to have it, but to also show it, and not just for learning clinical science, but also for learning, research techniques and skills. And therefore, thesis is the first step towards doing this. So overall, the questions you ask define who you are, not only during your residency, but in the long term. Not the answers that you already know, right? So you need to push boundaries. You need to know what is not known, right? So, remember that, this is, this is not just limited to research, but for pretty much everything. So, what we'll talk about today is, thesis writing and then actually going and publishing it. And, if you do it well, more than 3/4 of your job is done, right? And I'm going to try to broaden your research horizons a little bit. And what we're actually, hopefully at the end of the hour is... Yeah, so this is going to strike more with the current generation residents is impact, right? Creating impact, and it's not just social media impact. And when you ask kids nowadays, so many tell, oh, what do you want to be? Someone small boy says YouTuber, the other small boy says influencer. And how do you get there? So first and foremost, you need to have that core strong, and everything else is a shell around that, right? So your core strength has to be your clinical science as well as your research skills, and only then will you be able to create impact. And you can actually create a lot of impact, as you will discover, and I'll let you discover your own impacts as you go ahead. I think I've already been introduced, so I'll quickly go ahead. But hopefully, from an author, then to a reviewer, and to a prolific reviewer, and then from an associate editor's point of view, I've had all these hats. Of course, I was a resident like you about a decade back, so and a fellow, right? So I'll be able to give you a unique perspective on all of these things. And also a little bit about Sengupta's Research Academy, and it was established 8 years back now, and the whole objective is to empower you to publish your research, your thesis, and all of the other studies that you do. And so there are some e-learning courses, and you can explore the website. And this is about a year back. This is the sort of the footprint of the academy on the world map, and now we have more than 6,000 enrollments from about 95 countries. So so you can be part of this community as well. A quick rules is, hopefully all of you are actually focusing and paying attention, and not, and not really thinking about anything else. Remember that learning something and not being able to apply it later on will, negate it all. So if you're listening to it live, or deferred live, or delayed on YouTube later on, just focus on what I'm speaking for the next 30 minutes, and that will actually do a lot of good. So why are we doing this, right? So as thesis is not that easy. It is hard work, right? So you will need to work hard on thesis, right? So a lot of our focus is on clinical skills, acquiring gonioscopy skills, to indirect ophthalmoscopy, to making that incision and putting that first IOL. But remember, you need to also focus a little bit on literature review, on doing that, finding that small p value, and then actually writing your thesis well. So you need to work hard, and perhaps doubly hard, to get both these skills, the clinical as well as the research skills. So it can be frustrating. We know that, right? I mean, that's what I hear, and I actually travel all over the country. So day before I was in Mumbai presenting. Yesterday I was in Chandigarh presenting, and on Sunday I'm going to be in Hyderabad physically presenting, right? So I interact with a lot of people, with a lot of thesis guides as well as students. And first and foremost, I get that feeling that, oh, this is so frustrating, and why is this necessary? Why is this required, right? So remember that though it is difficult, it can be messy, we know that, but still that joy of doing something beautiful has to be there, because you may discover something that no one else knows. That question that you've asked is important, and the answer you find is a beautiful one, right? So
research and discovery.
I'm going to quickly show you, what a Nobel Prize winner in physiology and medicine thinks about research.
Research and discovery is about exploring our frontier of knowledge, where we don't know. We don't have everything worked out. It's not neat and tidy. It's not that you're trying to do things that we know how to do. Understanding how to deal with things that are messy is so fundamental to research. Messy because you don't even know what the right question is. So how do you develop a robustness to when things aren't perfect? Goodness knows that's going to happen. And I think it's just an acceptance that things are hard and messy. Things are complex. Your job as a scientist is to figure them out. You have to kind of relish in the mess. I think it's really interesting when things don't work, because that's the path to discovery. Scientifically, when you discover things that are inconsistent with how our current paradigm tells us things should look, it's like, oh, well, this is interesting. Like, things don't work. There's something more to be discovered here.
If a Nobel Prize winner thinks things are messy, and you have to revel in that question, right? So unless you ask questions, you will not even know what is the right question, isn't it? So there has to be the joy of doing something beautiful. So you need to be curious all the time. And so this is Dr. V, who was the founder of the Arvind Eye Care system. And I'm not sure you've heard about him before, but he established the Arvind Eye Hospital group when he was, when he had retired from his government service. So who says that you're old enough to do things and young enough to not do things, right? So, take inspiration from this. Also, I'm going to show you another video before we deep dive into this by Professor Amod Gupta. And I'm sure, and I really hope that you've heard about him from PGI Chandigarh, right? So he's going to talk about, asking questions. So, just learn to be curious, to be a good researcher, and then to also become a good physician, you need to have this mindset. So that's hopefully what I'm trying to instill. And before we actually see how to do this, right? Is there any special message for young researchers who are watching this episode?
For the young researchers and young doctors, my parting advice would be to not stop asking questions. What I say is, before you learn the answers, learn to ask questions. In my paradigm, learning questions, how to ask a question, how to frame a question, how precise you should be in asking that question and asking your query. I think that's what, with the availability of Google and such search engines, it's so easy to find whatever is known about a particular subject, about a particular aspect of a question, and you need to find out the outer boundaries of knowledge. You need to figure out what questions have no answers, and those are the questions you need to chase in your research. They are the questions which you should frame your research grants and research questions, and try to figure out the answers. And I'm sure all those answers that you find, all those papers that will emerge would have a huge impact all over the world.
So the whole question is, why should I do research? Thesis is just one off, so are there any more advantages of doing research? And, like Professor said, asking questions, chasing them, it's a lot of hard work, right? So this is a quick mnemonic on why you should be doing this, so I've tried to make it more attractive for you to remember. So the mnemonic is famous, that fame, F stands for fame and recognition, A stands for patient care, and a lot of your pivotal research studies can actually, have a huge potential to enhance patient care. M is make yourselves a good clinician, because a lot of to and fro will happen between you and a journal editor and reviewer, and they will ask a lot of questions, and sometimes you will have like those moments, like, why didn't I think about this? And so subconsciously you're actually getting better and better at problem solving and troubleshooting, right? So you will become a far better clinician than if you were not doing research, right? So policy decisions will be influenced by some of your papers. Almost a couple of years back, I got an email from a judge who said that, I made this decision based on a paper that you have written. And that paper was published in 2010. It was about caterpillar hair going into the eye. And, somebody had actually, filed a case saying that the doctor was negligent. But then the judge saw the paper and said, oh, this happens, and, this is possible, and doctor has taken all possible precautions. So, so much can actually ride on some of the important work that you do, right? Also, in a lot of policy decisions, so don't think your papers are going to be read only by your peers. Judges would read your papers, IAS officers may read your papers and say, I'm going to allocate these funds to this program based on some of these papers that I have read, and maybe out of those papers, one might be yours, right? So U is for funding and grants. So your research makes you eligible to apply for large grants and funding, and unfortunately, we don't know where to apply for. And we might have another class on grant craft where I can actually tell you, the different avenues. Maybe one I can tell you is called Trialect, TRIALECT. So you can go to trialect.com and explore. And because all of you are residents, you will see opportunities for international fellowships which are outside the ICO on Trialect, as well as opportunities for research funds and collaboration. So please go and explore that. And of course, S stands for personal index. By what I mean by that is citations. So when you write a thesis, you will have like 120 references, or maybe 30 references if it's a relatively novel topic. But then imagine that you publish your thesis, and your thesis then becomes part of someone else's references. Don't you think that's possible? And it will be, right? So so if your thesis and publication is part of many other published papers, that means you are having an impact. You are influential, right? So this is what I say is an influencer, because you are actually influencing future research, isn't it? So, it's not like, breaking a leg for 30 seconds on Instagram and saying, oh, I'm an influencer. So that's not really how it should be, right? So at least for physicians, that's not how it works, right? So personal index is how many citations do you get, and that really increases your prestige in the medical community, right? So, some of Dr. Santosh Honawar's papers have been cited more than 3,000 times on retinoblastoma, and he has had an impact on management of retinoblastoma like none other, right? So, so that is tremendously improved his prestige in the medical community, and of course, so many other things. But, so remember that by doing good research, famous is something that, don't take it literally. Of course, you will become famous as well. And maybe some of you might be presenting on the iFocus platform, in a few years' time, and pull out the slide and, and talk about it. But, there is so much to gain from research, and take thesis as the first step towards that, right? So let's now look at how you do a good thesis. If you might not have the time now, maybe you look at the recording later on and, scan this with your camera, and this is a QR code, and it'll take you to a quiz, and it'll tell you how much you already know about thesis and research. And then you could take the quiz again after going through the next 30 minutes of what I'm going to teach, and then take the quiz again, and then see how much you've improved, right? So, this is something that you can actually interact with this session. So let's get into the nitty-gritties of this. Now, remember that a lot of the theses that we do are not published at all, right? So there are so many reasons for not being published. There's not enough novelty. It's not new. The methodology is not right. There's not enough training, especially by faculty, and therefore residents are also not trained. There's not too much enthusiasm about doing good work and finding something new. Pushing those barriers needs a lot of force, isn't it? You can't just push barriers and say I've pushed barriers, right? So it needs a lot of force. I mean, it needs a lot of resources and a lot of brain power to do that. So, a lot of people are not enthusiastic about doing it. And, a lot of people are not at all aware of the benefits that you could have going forwards if you have published some papers in, during residency, especially if you can publish a thesis. Remember, if you publish a thesis, you are already in the top 10% of your peers, because not even 10% publish their thesis. Right. So there is not enough study as yet. We don't know how many are doing, but then, the numbers are increasing. But then if you're able to do, that it's nothing like it. So don't say I can't do it, right? Just cut it out and say I can do it. And, with that motivation, let's actually see how you will be able to do it. So this is the overall outline that I thought we'll talk about. First is, how do you choose a topic? So how do you choose a topic? It's so this may or may not be entirely in your hands when you are choosing a thesis topic, because you're quite new into ophthalmology, and your thesis topic is perhaps levied on you by your guide, or a lot of the times the guide say, go and find 10 topics and come, and I'll choose one of them. And you're like, what are you talking about? I'm like entering into ophthalmology, and I'm struggling with the mnemonics. And what was this PCO and PCV? Both sound the same to me, but they're miles apart, right? So, what is this slit lamp, and, what is this inverted image? Is it superior or inferior? What am I seeing? And at that time, if somebody tells you go and choose topics, it's a no-brainer. You're not going to be able to do it, right? But then, I'll still show you how you perhaps can do it. But then choosing topics will be even more useful when you are into second or third year, where you want to do additional research, and maybe especially for, useful when you enter into fellowships, where you are perhaps even expected to do 1 or 2 studies, right? Then you look at how to do literature review using PubMed, and I'll show you a live demonstration. Then, we'll talk a little bit about the methods, and then data and Excel. How do you analyze, what are the sort of guidelines you will use, and then how do you write a discussion, and then finally how you publish a thesis. And, I'll hopefully cover this in about the next 32 minutes. So choosing a topic has to be, remember, it has to be novel. That means has not been done too many times in the past. It has to be doable. I mean, in your own settings, if you say, oh, this is a study on OCT angiography in so-and-so disease, or say wide field retinal angiography, or ultra wide field angiography, or something like that, but then you don't have the machine in your settings, it's almost impossible to do, right? So is it doable in my own setting? Sometimes you will say, oh, this is a very interesting paper on corneal diseases, and I'm interested in this disease, say keratoconus. But then I don't see that many in my setting at all. I'm just giving you an example, right? So you might want to do studies which are more common in your settings, like corneal ulcer or something like that, right? So you need to find what has not been done. in that, right? So finally, then all these make it publishable, right? So it has to be novel, it has to be doable, and it has to be publishable. So this is how, sort of an outline on how you get good topics. First is you can subscribe to e-table of contents of some of the top journals. I'll show you one or two live demonstrations in the next slide, but subscribe to e-table of contents of journals. So the top journals in ophthalmology, we know there are ophthalmology, JAMA ophthalmology, AJO, BJO, survey ophthalmology. So try and read some of these journals. Subscribing to e-table of contents is free, right? So what you need to do when you subscribe is every month these journals will be releasing a set of articles, say 10, 12, 15 articles, and that is called the journal issue. So January will have one, February will have one, March, and so on, right? And they have been doing it for the last more than 100 years, right? So what is happening now? So what is the new research being published in JAMA ophthalmology, say? So what this will send is an email to you. Okay, so the new issue of JAMA has been published. And when you open that email, you will at least see those 10, 12, 15 papers which have been published this month. And if you consistently do it for at least 2 or 3 months, you are bound to click at least 1 or 2, right? And dekhen to bhai kya hai ye. When you click, it will take you to the abstract, and you will know at least what was planned, what was done, how it was done, and what they found, right? So you will start getting ideas. So the whole agenda for this slide at least is how do you get ideas. So ideas are a funny thing, and it will grow in your mind, right? So table of contents is a great way to get ideas. PubMed update. So though we don't have enough time, you can actually tell PubMed that I am interested in corneal ulcer, or say in fungal corneal ulcer, and say in intrastromal voriconazole for treatment of fungal corneal ulcer. Or you can tell PubMed that I'm interested in keratoconus, and I'm interested in say tear film molecular characteristics in keratoconus. Or you could say, you can actually tell PubMed I'm interested in diabetic retinopathy or diabetic macular edema, and use of say faricimab in diabetic macular edema. Whatever your thesis may be, and you can tell PubMed that whatever comes on this topic in the next week, please let me know on Saturday 5 p.m. So it'll actually act like your personal assistant, and it'll actually keep sending you on Fridays or whatever Saturdays. You can choose the time of the day, and you can actually choose pretty much everything. So please go and create an account on PubMed. So the PubMed's account is free. You have to save the particular searches. So we can do a whole session on PubMed search actually, but then we don't have time enough. But PubMed is another way of you are anyway going to do a PubMed search for your thesis literature review, isn't it? So save that search and tell PubMed then whatever comes new on this every week, I want to know. That is, sometimes it will happen that you've done a literature review, then you're starting to write a thesis after 2.5 years, and beech mein bahut pani beh gaya hai. Like a lot of studies have been done now, and then your literature review is also outdated. So it's good to remain in touch with this real time. And this need not only be restricted to your thesis, but also to any other topic that you are interested in and want to say pursue a fellowship or something like that. You could create multiple, you could save these searches and then tell PubMed, I want to know what is new. People will be alarmed and saying, oh, this fellow knows so many new things. Kahan se usko pata chalta hai? They don't know that you're making PubMed work for you in the back end, and that everyone could do it, right? So this all these things will get you miles ahead of a lot of your peers. Of course, ideas from clinics should never be neglected. You will get a lot of ideas from your clinics, right? So be curious, so, oh, this patient was given this particular injection, or this patient was fitted with this contact lens, or this patient was given this particular treatment and it did not work. Then you might see after 2-3 days another one which has also not worked. So what's happening? That why are we doing this? And then you will say literature says that 80% have good outcomes. But then you will see that in my settings, not even 20% have good outcomes. So then that becomes an idea, isn't it? So then you pursue it, and then you see, what's happening. You can think about joining collaborations. You can actually go to large meetings. So the point on meetings is also covered in this, where you go and meet potential mentors. And then nowadays there are a lot of sessions in the Yossi forum, as well as mentor-mentee sessions, and a lot of collaborations are already happening, but unfortunately they are only for fellowships or for some socio-cultural activities. But I don't see research collaborations being formed. So maybe you could even take the lead and say, this is a particular study idea I have. Why don't all of us get together and do it, right? So you can even create groups, or perhaps then invite others to join groups, right? And then having journal clubs is a really good way of finding new ideas. So monthly, at least one class should be a journal club. So what you do in that is you actually try to learn what is new from that published paper. So you take a paper from a journal, hopefully a new paper, and then you dissect it out, right? You try and critique it. The main idea is to learn research techniques and critique these papers. And once you critique the paper, finally you will find that, oh, there is so much problems with this paper. Why don't I do a study, and if it's feasible and doable, why don't I do this study with a similar methodology, but taking care of all these problems, and then see what the outcomes are, something like that. So having journal clubs is a great idea. Other thing is that if you discuss a paper and there are too many lacuna in that paper, you can put them all together and write a letter to editor to that journal, and to your surprise, a lot of them might actually get accepted because your critique is to the point and something that even the editor and reviewer might have missed. Right, so journal clubs are a really good way of getting good research topics, and faculty which are involved, they actually keep getting ideas, and they will have a list of 5-6 thesis topics ready for you when you're entering to residency. Imagine the guide telling you, these are 5-6 ideas, choose one and we'll do it. Instead of saying, go and find 5-6 and I'll choose one. Instead of that, it's all reverse now. They say, oh, I want to do these 6. Which one are you interested in? Okay, you just do this one for your thesis and do this one additional one, so that, so it'll all be totally flipped, right? So hopefully we'll get there someday, but if once you become faculty later on, perhaps you could also do that, right? So this is how you get good research topics. So like I said, I'll give you one quick demonstration. So this is the homepage of the JAMA Ophthalmology Journal. Right, so this is JAMA Ophthalmology. Yeah, so once you see here, it says get the latest from JAMA Ophthalmology. This is on the bottom right. So what you do is you basically just enter your email address. So I just do it, and I'll just say sign up, and that's about it. It's as easy as that. So let me just click it. Right, so it says thank you. You will receive an email shortly to verify your email address, and then all of this. I've already done it, but then you can do this. So this is so every month, whatever JAMA Ophthalmology is getting published, it will come to you. And not only the issue, but also ahead of print. There are many papers which are published ahead of print, which will also come. So do that for JAMA Ophthalmology, for ophthalmology, and so all the top 5 or 6 journals that we have. And also don't forget that Indian Journal of Ophthalmology also is it's quite impactful now, and they are good reads most of the months. So if you're a member of AIUS, you will actually receive those those emails on your own. But if you're not, you can also subscribe to the IJO table of contents. Second is review of literature. Remember that we want to do a review of literature to find what has not been done instead of what has been done, right? So what has not been done is really what we are looking to find. So the way to look at is first find the problem. What do you want to solve? And then create a hypothesis to prove or disprove that problem, right? So say, for example, does cataract surgery cause a drop in intraocular pressure? That's your question. And the hypothesis is IOP drops significantly after cataract surgery. This is actually happening intuitively in your mind, but we are not differentiating the two, right? So I think cataract surgery drops intraocular pressure significantly, but does it? We don't know. So that's my hypothesis. But so the question is, does cataract surgery cause a drop in IOP? Say, do outcomes in phacomorphic glaucoma differ from phacolytic glaucoma? That's a question. And my hypothesis is that phacolytic glaucoma has better visual and IOP outcomes compared to phacomorphic glaucoma. So whatever that may be. So a question and then your hypothesis, and then we will try and prove and disprove this hypothesis, right? So that's really the best way to think about literature review. So now here is this known? Why I'm talking about the problem is this known? Is the answer for this known? And when you do a search like that, you will find out whether the answer is known or not known. Instead of just saying, oh, glaucoma pe koi search karke aa jaiye, just saying, oh, let me see what has been done in phacolytic and phacomorphic glaucoma, you're not starting with a question, right? You're starting with a blank sheet, and that's not a good idea, right? So once you start with a question, you will want to, your search becomes that much more goal-directed, right? So like I said, your literature review writing also has to be goal-directed. You can't say anatomy of the lens is this and physiology is this and fill up 20 pages with different things about the lens, and then start with what, so a lot of MS ophthalmology might expect that, but then DNB definitely doesn't expect that, right? So your review literature has to be very goal-directed, about 7, 8, 10 pages at the most, right? So good literature research really depends upon your keywords. And remember that your keywords should be mesh terms. Again, we don't have a lot of time to get into this, but use this as a keyword itself, right? So search about mesh terms. you should use a proper strategy. So I'll show you what is a Boolean search. That's using and, or, and not, and then always use the advanced search option. So I'll show you one screen recording. So say the question is, what is the incidence of post cataract endophthalmitis, post cataract surgery endophthalmitis in India? Right. So we're looking for incidence, right? So first pick out keywords in this. And let me go to the previous slide. So what are the keywords? What is my search strategy? And then how do I use the advanced search? So what are the keywords here? Of course, the hero is cataract surgery, right? Because that's what we're talking about. And the disease we're looking at is endophthalmitis. Endophthalmitis can happen after trauma, after surgery, and after endogenously and other things. We want to see only in India. And then we want to see only the incidence. We want to see out of 100 or out of 1,000, how many get cataract. So there are so many different aspects of disease, right? Incidence, risk factors, treatments, outcomes, so many other things. We are mainly interested in incidence, right? Because, say that is a study I want to do. So this is a screen recording. So you go to the advanced search option and, you start populating your keywords. So we start with, say, endophthalmitis and just say add and you search. Never start just with the whole topic here. If you just search for endophthalmitis, you'll see there are 11,000 results. It should be sorted with best match. Sometimes it may not be. So just see to it that you are looking at best match, right? And it should be on the summary, not the abstract. And this should always be on the best match, not on most recent or otherwise. But you could also sort it like that, right? These are all sorting options, right? So you're seeing that there are 11,000 results about endophthalmitis. Now I want to narrow them down. Now what I'm going to do is repopulate that. So I'm going to say actions and add query. See that an endophthalmitis automatically come in the query box. Now I'm going to say in India, and I'm going to try and narrow it down. Right, you see it has gone down to 761 results, and there are many other ways to sort it down. Right, so this is the first result which comes, and I am a co-author, fortunately, in that paper. You can it should be there, and now I want to narrow it down more. So you don't have to type again and again. Just say add query and you will have that there. And then you say post-operative. You could say cataract surgery also, but post-operative is the mesh term here, right? So now it has come down to 281 results. We started from 11,000, we came down to 700, then we've come down to 200, right? So, starting with a question will give you this perspective, right? So then add query, and then I just want to look at incidence. Main papers which talk about incidence. And then now it has come down to 85 results. Now that is doable, right? So, so this is a little outdated. You might get some more papers if you do the same thing, but this is the way to do a PubMed search, right? And you can also filter it out based on what is there on the left, so you can slide this and say, I want only papers from 2000. That's like relatively more recent papers. You will see 81 and you will see these trends, right? So, this is more papers are recent, right? Then you can also say, I want only free full texts because I want to read all of them, right? So you go down to 36 results, right? So you can actually filter it like that. You can say, I want to look at only systematic reviews or only review articles. So there are only 11 articles, right? So you can actually go and read all of them and actually find, a lot of information. This is also helpful for, reading any topic. Say you want to read about vitreous hemorrhage, you can do a PubMed search and go to systematic reviews and find. You can sort it with publication date and so many other things, right? So this is the way to do a proper good literature review, right? So sometimes you will find that there is nothing there. Oh, there is nobody has done this study at all in the past. Remember that you are perhaps mistaken because your mesh, keywords are not mesh terms, or perhaps you're not using the advanced search strategy. You are just straight away you can type incidence of endophthalmitis in India, something like that, and you might see there are only like 20-25 articles. But so always do an advanced search to see and refine your search, right? So start with a broader term and narrow it down. Like I always give this example of a Google Maps, a very large, so you're looking at the whole world, then you're zooming into India, then you're zooming into say Maharashtra, and then you're zooming into Mumbai, and then you're zooming into where I am sitting, or for your own location. So your literature review has to be very goal directed, and you can actually tabulate results. So let me show you a quick example of that. And this is watermarked so that sometimes people misuse that. So this is a literature review from recent to older, and it's about retinopathy prematurity. So it says retinopathy prematurity prevalence of aggressive ROP. So this paper is talking about aggressive ROP, not just any retinopathy prematurity. the associated risk factors for ROP and ROP-related childhood blindness. So this is the literature review that the person has done. So you can make a column like this, which is serial number, then place and year of the publication, the author's name or the first author's name. So you say, Anand Vinekar is the first author of this paper. This is the title of the paper. These are the methods used, and this is the summary results. Right. So this is somehow, this is a good way of actually, in one place you will see, try and do this even when you're writing answer sheets, especially when you're doing it with DNB, because, that yields you far quicker marks, or better marks, because it's, it's well presented, your examiner will find it very easy to go through what you've written, and all the key messages that you want to give in a particular answer will all be there, right? So this, you can do that. So this is a study in July 2021. This is in international, this is the topic, this is the a review article, and this is what the paper talks about. So this is a good way of actually writing your literature review. It doesn't take that much space either, and it's very goal directed. Next section, what you need to write is what is a lacuna. Ki bhai, this has not been done. So what are good lacunae? You can't say I'm doing a study on pterygium excision with conjunctival autografting. Like zillions of people have already done it. So is there a lacuna even in that? So what are the risk factors for displacement of graft? Or, say I can tell you a lot of retinal diseases questions, but then, I don't want to, get into the details. But the first and foremost is there are very few studies addressing this question. Right. So somebody was talking about a study on radial keratotomy and post-radial keratotomy cataract surgery. There are actually some studies here, but then what has not been done is, so many times these are weak corneas and you need to take sutures because they start leaking. So what the study was finding is that half of the patients had a wound leak and needed suturing, and the rest half did not have a wound leak and didn't need suturing. Right. So can you actually compare and see outcomes and other things, right? So that is something which has not been addressed, right? So you need to find what has not been done. You can also say samples that the previous studies were small, and therefore I'm doing this new study. Say I can give you an example of a study which was looking at corneal infections post collagen cross-linking for keratoconus. That keratoconus is treated with cross-linking if it's caught in time, right? So, but then, so most keratoconus the CXL procedures will, have corneal wounds and covered with contact lenses, and they can actually get infections, right? So, a paper was published in the Journal of Cornea, which is like the biggest journal, and they talked about a series of like 30 eyes over a 10-year period. And then somebody from a very large institution says, "Arey 30 year to hum to saal mein dekh lete hain." So I might have a series of like 300 eyes. And then obviously, your outcomes will be better, right? So you can say samples of the previous studies were small, and I'm a relatively large volume center, and we have more cases, and therefore we are doing a similar study, and that is also acceptable. You can say this aspect of disease is well studied, but this is not studied. Say, for example, there were a lot of papers on caterpillar hair and the eye, but there were no papers on caterpillar hair going into the posterior segment, into the retina and vitreous, and what are the risk factors which predict this. So what we found is if there are hair in the corneal stroma, usually the hair will get lodged in the tarsal plates. But if there is hair in the corneal stroma, then the risk of intraocular penetration is almost 8 times higher. So that was not done. So that was again a lacuna. Are there racial differences? You could say, especially in like diseases like glaucoma, where there are racial differences, right? African Americans, they are racially different from Caucasian Americans, from us, from the Chinese. So you could say, there are previous studies on this kind of glaucoma or this management of glaucoma in this population, but Indian population has not been done. You can't just say, oh, this is the first study in India. So what? It's like, so what? So do you expect Indians to behave differently from Chinese eyes or from, say, from Mexican eyes? Not really, right? Or from German eyes? Not really. So when you talk about, say, intravitreal injections of, whatever anti-VEGF agents, almost all of them behave the same way. At least we think that way, right? So racial differences may influence some diseases and may not. So, if you say first disease or first LASIK in India, that does not qualify, or say first silk procedure in India, that does not qualify it as a lacuna in literature. It may get published, but it's not a lacuna, right? So what is not a lacuna is the first study in India. And that is the USP of a lot of authors, but then, and people get upset when you are rejecting papers like that, but then that is not a lacuna, or you need to justify what is the key thing here, right? The first intervention in India, a lot of grandiose claims from 1 or 2 case reports or case series. And a lot of the time the scientific, the hypothesis is not scientific. Remember, you ask a question, then you form the hypothesis. But then if you just form your hypothesis, but that question also is not clear at all, then everything will go bad, right? So you'll get 0 stars out of that. So next step, what after review of literature, you need to find that lacuna, right? So remember that review of literature is with the perspective or point of view of finding lacuna. Let's look at, I'll quickly go over consent. There is consent forms are, I think, now generally available almost everywhere. Let's look at methodology. So what you need to actually concentrate on when you're writing your thesis methods is the PICO approach or the PICOT approach, where P will stand for participants. That is, who are your participants? Think about your inclusion and exclusion, right? So the first part about your methods section of your thesis when you're writing it is about who did you study. So write everything in detail about the inclusion, say 7, 8, 5 or whatever inclusion criteria, and then in detail about exclusion criteria. Even like, pregnant women were excluded and whatever, all of those are important exclusion criteria, though you may not be thinking about it, but then, it all becomes that way. So when you say, all other coexistent ocular comorbidities were excluded, but then when you're writing a thesis, you need to be more specific about it, right? So participants, and I stands for the intervention. You need to describe it in a lot of detail. Excuse me. So detail means if you're talking about a surgery, almost all surgical details. If you're talking about a questionnaire, talk about how that was developed and everything that you did to get that questionnaire. If it was an interview or if it was just an observational study, everything that was done on each visit, everything in detail, right? How IOP was measured, what time IOP was measured, whether person measuring the IOP was masked particular group or not, whatever you can think about, right? So intervention will make a large bulk of your of your thesis method section, right? So be as descriptive as you can. Remember that if somebody else wants to actually entirely replicate your study, this intervention section will actually help them, right? So all the details, and you need not, you will cut it down quite a bit when you're writing the manuscript, but then a thesis should have all of that, right? Then talk about comparison group. Also think about, do I need a comparison group here? Say you're talking about some particular intervention or particular way of treating corneal ulcer or something like that. What if I don't treat it, or what if I treat it with something else? Now that becomes a comparison group, right? So especially, we see a lot of people talking about, a lot of innovations and other things. But then the real key question is, do I want to adopt that? Right. So I will adopt it only if it is better than what I do currently. That's human thinking, isn't it? If I'm already happy with the lens and a particular delivery system, why should I, change over to the new one? Unless the person who has done the study will actually compare with the existing gold standard, right? So your thesis also need to have these kind of considerations. So, talk about that. Sometimes you may not have a comparison group, but, at least think about it. And then O stands for outcome measures. Define your outcome measure well, and differentiate into primary and secondary. Primary outcome is what you exactly want to study, right? What is that one main question, So does IOP drop intraocular pressure? There are many other things you could say, phaco versus SICS in this, or you could also measure endothelial counts after the surgery and so many other things. They are all secondary outcomes, right? So does phacomorphic glaucoma do worse, or phacolytic glaucoma do better than phacomorphic glaucoma? So there are so many other outcomes, isn't it? Not just intraocular pressure, but vision and complication rates and endothelial counts and so many other things. But intraocular pressure then becomes your primary outcome, isn't it? So that did the IOP get controlled, and or perhaps your outcome measure is complication rates. But you have to define that well. And then talk about the type of the study. Is it a prospective study or a retrospective study? Most theses actually should be prospective so that you learn better. But then sometimes you have to do a retrospective study. Think about whether it's a randomized or a non-randomized study. And a lot of the times thesis may find it difficult to do randomization, but masking is very much possible. Sometimes we may not randomize, and things may just get automated, automatically randomized. We call it quasi-randomization, where somebody who is affording a cataract surgery with femto will go for that, and the other who is not affording femto will go for the regular phaco. Later on, remember, you have not randomized as such in the study, but then it has auto-randomized itself because of affordability. But then when you look at it post, when analysis, you will see that both their baseline characteristics are very similar. Right? So then there is auto randomization, but then masking is very important. And masking is what you can do even if you're not doing an RCT. So think about any points during any visit which will do with masking, which will do actually better with masking. So look at masking and all of the other things, and always remember some of the limitations that you have and try and work around that. So this is your method section. So basically this is the PICOT approach. So really materials and methods. So the materials actually refer to the study participants, and the methods refer to how procedures were done. So you are answering questions like what, when, why, how much, how often. So this will actually guide someone else also doing, and also your own self later on, right? So it's good to write these detailed methods even before you start. And so we actually will call it manual of operations in large clinical trials. But then you could, why can't a thesis have a manual of operations? So we should think about all the possibilities and include them. So when you write it, first thing is you'll write about ethical considerations, and that informed consent was taken from patients, and the different declarations. Basically, we are not exploiting patients. So that's what this talks about. Then you talk about the study period, the location, and the type, and the month and year from where it started to end, your name of institution, and the type of the study. That's prospective or a retrospective, etc. Then you start about inclusion and exclusion criteria. Describe everything in detail. Inclusion really is who are you studying, and exclusion, more importantly, is who are you not studying. And then how study participants were prepared. So anesthesia was done, OCT was done, this, that, all of that. That is at baseline. And then protocol at each visit, right? So at baseline, this is what was done, and that each follow-up, you may actually measure IOP at each follow-up, but you may not measure endothelial counts at each follow-up. So everything that was done at each visit needs to be documented. Measurement of variables, right? So how did I measure these variables, and all the tools and instruments used? So intraocular pressure was measured using applanation tonometer or using non-contact tonometer or whatever that may be. And so, adding that detail is really important. And then describe your primary outcome, define it well, like I said. And, you need to think it in terms of statistical terms of whether it's a continuous or a categorical variable. And, perhaps we'll have another session on, some of these things. But, I think I have presented a previous session on statistics, and I will actually be doing it sometime next week. So, you can actually, tune in and we can discuss more about statistics. Also, plan of statistics is really important, right? So that includes sample size calculation and what tests will be done to find those relevant results that you're looking for, right? So this is a method section. So this is a quick summary of the PICOT. These are all infographics, right? So how to find a research topic. And I'm showing you all of these. They are all available on the Sengupta Research Academy Facebook page, and you can actually scroll down and you will get a treasure trove of information about not just thesis, but a lot of aspects of clinical research. Then we look at data. So let me quickly show you a quick demo. So this is a so you're going to actually record all that in an Excel, right? Let me show you. This is an Excel. You're going to record all of this in an Excel sheet. Yeah, it is loading. And then what we are going to do is convert that Excel sheet into the result section, right? So Excel has to go through something else, and then it'll, so what is that something else? Is the statistical software package, right? So this is an Excel sheet, and let me load something else in the background. Okay, so this is an Excel sheet. Just 1 second. Yeah. So this is the Excel sheet that I'm talking about. So this is that phakomorphic and phacolytic glaucoma study that I was talking about, right? So there's the basic or baseline Excel sheet. It talks about serial number, medical records, age, gender, date of presentation, surgery, all of these. This is distance in kilometers from, from the base hospital. This talks about duration of symptoms. This talks about decrease in vision in months. So this is almost not usable. If you think this is a very good Excel, it is not. You can't use it. So there are some basic rules of making an Excel, and you can actually watch that video on making an Excel sheet. It's on Sengupta Research Academy YouTube page, and also I think it was on the Yo slides, Yo channel that is also there. So you can just Google it up. So this is not okay. So decrease in vision in months, but then this is in days. Now this is in years, but then they say initially it is in months, right? everything has to be in the same, same unit. If you say months, then you convert everything. So 15 days becomes 0.5 months, isn't it? Half a month. 1.5 years now becomes like 18 months, right? So that's how you should enter that. And, remember that this again is not usable. Now, what is 2A? What is 1A? I don't know what is 2A, what is 1A, what is 3A. The statistician will also not know. When you send this to the statistician, say, bhai, mujhe analysis karke de do. They will not be able to understand only kya ho raha hai. So how do you make a proper Excel is exceedingly crucial to doing the analysis. And we don't have enough time to get into that. Again, this column, BCVA in right eye, BCVA in left eye, this column is not utilizable. Fractions can't be utilized. English alphabets cannot be utilized. So that's why you need to enter logmar. So you've read in papers, that vision was converted to logmar for analysis. That's what I mean by that, right? So what we do is we are going to import this into a statistical software package. So let me try and show you. So this is basically Stata. This is a software package, and it is still loading. I'll quickly show you. So this is what we do. So this is the software. I'll show you some images from that. It's still loading, right? So, so this is the Excel sheet. All of you are going to go through this. So, better pay attention. So this is the Excel sheet. Now, this is the cleaned master sheet, right? If you see, there are, except for this residence, there is no more alphabets. Cancel. So the first one is the only one where there are alphabets. Everything else is clean. There are no alphabets here. Just 1 second. Yeah, so this is also done. So there are no alphabets here. It's very important. And what do I mean by 1 and 2? So I go here and it says right eye is 1 and left eye is 2. Right. So this is called a code book. So type of surgery. One is SICS. Remember, there's phacolytic or phacomorphic glaucoma. SICS with IOL, SICS without IOL, phaco with IOL, phaco without IOL. So so you don't write those words, but you give them some numbers and categorize them. These are all categoricals. So pre-op vision, BCVA, right? Two means finger counting, something like that. Pre-op BCVA, left eye. Pre-op IOP. So some are very low, right? Because they are already on medications for that glaucoma, right? So this is a cleaned Excel sheet. This is what is necessary for analysis. Then what we do really is, we import that, let me show you. So this is Stata, but, there are many softwares. What we do in Stata is, I'll go and say file, and, I'll just import that. I'll just hopefully be able to, so there's a lot of data here. So, when I import that, all these variables are there in the Stata, right? So the same thing, MRD number, age, gender, date of surgery, residence, duration of vision, etc., right? So once it's here, I can actually do everything and find out what is, so let me look at diagnosis. How many phacolytics, and this is a, this is a, this is a syntax. I'm telling Stata I want something like this. They'll tell me there are 10 phacolytics and 18 phacomorphic glaucomas in this study. It's all lopsided towards phacomorphic glaucoma, right? So, do I think phacomorphic does worse or phacolytic does better? Do you think this study is now okay to answer that question? Of course not. That's because there is not enough phacolytic glaucomas, right? But then the reality is, especially in a rural place, mostly it will be phacomorphic glaucomas, right? Now let's look at gender distributions. This is how a statistician will actually do it. They will write syntax. You can also do it if you know this syntax and if you have the software. There are 90 women and 38 men or 40 men. A study where there are far more women, that also shows that, these women are perhaps neglected and coming much later for all of this treatment. So they have neglected to the point where phacolytic has happened, right? So that means they have mature cataract for at least like 6-8 months or maybe even a year, right? So that's how an Excel will travel to this is an Excel sheet, and let me just show you in one place. So this is the Excel sheet. This is the analysis sheet, or this is software. And then what we are going to have is the results, right? Next is the results. Let me quickly show you the results. Okay, so this is the results. right? So you talk about statistics that your statistician can help you. First and foremost, what you will do is, let me show you the Excel again. First you will describe everything. So every column will have its own description, right? So age will have its own description. What is the mean? What is the median? What is the range? Minimum age, maximum age. Then you talk about gender, how many men, how many women, etc. Then you talk about, distance from, distance from the base hospital. Then you talk about duration of symptoms. What is the mean? What is the maximum? What is the minimum, etc. And so let me show you quickly. So age. First is you talk about mean age of study patients was 64 with median and interquartile range. This is how you represent continuous variables, and we'll talk more about this when we talk about statistics. This is called a box and whisker plot, and it's the best way to show a continuous variable. Then you talk about gender, then you talk about distance from base hospital. So what I'm trying to tell you is every column will have its own definition, will have its own space in the result section, right? So you talk about details of every column, and we are talking only about that one variable. We are only talking about late and late kyun aaya bhai. So what this talks about is distribution of patients based on 25-kilometer increments from distance, hospital pie chart showing distance wise how many patients were there. Then this is about duration of symptoms, again box and whisker plot. So median duration of symptoms about 8 days, right? So about 8 to 10 days. Most patients will of course have pain. So some of these analysis, here if you see, this is box and whisker plot showing duration of vision loss. This is far more than the glaucoma, isn't it? So this is what it shows like. This is why they did not come early. Economic reasons were the common cause, right? Distance from hospital. Second is better vision in the other eye. Now we know these things, but then what does your actual data say? So what I'm trying to show you is every column has its own, what is the diagnosis, what is the lens status of the other eye. So every one will have its own space in your result section. Once that is done, now we come to analysis. Now we are talking about two things in one, right? So is phacolytic better than phacomorphic? So something like that. So first is descriptive statistics. Second is analytic statistics. So this is the type of questions that we want to answer. Comparison between patients presenting, now this will depend on your data. What kind of analysis can you do? Comparison of patients presenting to paying and free section. I want to compare across the two. Comparison of phacolytic and phacomorphic. I want to do that too, even if the numbers are a little lopsided. Comparison based on distance between home and base hospital. Comparison between those with high presenting IOP versus lower presenting IOP. Comparison between phaco and SICS for management of lens-induced glaucoma. Factors indicative of visual outcome. So many. So these are kind of questions that you can ask, and then what you will do is actually you will formulate these blank tables based on these questions. So to the statistician, what you should send is these blank tables. This is the table. You say paying patients, there were 91, and paying patients, free section patients, there are 37. I want you to compare across these. So these numbers are not there to the statistician, right? These, let me just delete. So this is something that you should send to the statistician. So these variables are already there. These variables, right? These are already there. And these, this is what you don't know. And the p-value, let me just show you. So mean age in patients in the paying section is 64 and free section is 64 again. It's not significant, right? So some of this, so almost nothing was significant between all of these. Second is between men and women, and then let's talk about phacolytic and phacomorphic here. So phacolytic is only 10. I showed you before. Phacomorphic is 118. So you can still compare, though it is not fair because the numbers are defective vision is more in phacolytic group and less in phacomorphic group. We know the phacomorphic presents earlier, right? Because it takes a long time for the lens to lyse, but it takes, it swells and closes the angle pretty soon, right? So, these are the type of tables you should send to patients, to your statistician to get, proper results. Once it's done, you can actually then write all of that, right? So this is the, the result section of a paper. So the descriptives are almost half of the results, and the analytics are the rest of the half, right? So this is like a journey for your data, right? So this is the data sheet, and let me just pull them all together. This is the data sheet. This is the software package, right? So this is the data sheet, this is software, and these are the results, right? So this is a journey that your thesis is going to take. Just let me pull it here, right? So from here to here to here, it starts with the quality of the Excel sheet. So the Excel sheet should be made well, and then you can write the result section of your thesis. quickly to the discussion on, so results. I've already told you these things. In the discussion, you need to basically initially highlight your study, your study main, things that you found, and then each will have its own discussion. Let me quickly show you that example. So this is the whole results and the manuscript. So I mean the whole result section. So let me view. Yeah. So I'm going to go down. So this is the discussion. In the beginning, what we're talking about is the summary of everything because so many things have been done. The reader may not understand what has been done, right? So this says, in this prospective interventional study, lens-induced glaucoma, we found phakomorphic was much more common. Both SICS and phakomorphication was successful. Intraoperative complications for these many women comprised more, over 2/3 of our patients. Commonest cause of delayed presentation was so and so. Glaucomatous cupping was the most common factor predicting vision outcome at 1 month, understandably, right? And then each one will have its own paragraph. So phakomorphic was much more common. What did other studies say about this, right? So let's look at, so phakomorphic glaucoma seems to be the predominant type, and then you talk about what others say and why that may be so. Then second is phaco and SICS was shown to be effective in treating lens-induced glaucomas. What the previous studies on phaco is SICS in white cataracts or in dense cataracts talk about. So there are some studies from Arvind Eye Hospital which have done. They were not glaucomas, but then phaco versus SICS in these white cataracts. Then you talk about about 12% experience intraoperative complications, which is far higher than any other regular studies, which obviously is the case. But then how many were vision threatening, how many had all of this, and why that may be so. Again, we found women were more, so why that may be so. Lack of proper economic support and barriers to cataract and all of that. Then talk about, so each one, let me go back to the discussion. So each one of this is a paragraph on its own. If you see, there are 1, 2, 3, 4, there are 6 or 7 points we want to discuss, right? So I'll come here. So 6 or 7 paragraphs, almost half, 3/4 page each will make your discussion. So you're already looking at about 8 or 9 pages of, including that summary, you're looking at least 8 pages of your discussion, right? So that's how you would write the discussion. Remember that your relationship to other studies is very, very important, right? So you will say, oh, we found similar results, and then we might find different results. And then why that differences are is what you need to sort of justify. And you could say that, oh, they are previously were very small studies, and what I say is better. That's like criticizing the other one, right? So be prepared for criticism of your own papers in the future as well, right? So something like that. Then you can talk about some areas of improvement. So suggest future research, and then finish it off. So so remember, the difference between good and great is often an extra round of revision. I think so that is Atomic Habits is a great book if some of you have read it. The person who looks things over a second time will appear smarter or more talented, but actually is just polishing things a bit more. So it's hard work, right? It's more work, but then you need to finish your thesis in enough time, and then you will have enough time to go over it all over again, right? So take the time to get it right. So it's a good idea to actually just sit on it for a week, forget about it, and then come back and even take a look at it second time. So you can revise it and make it even better. And sometimes that could be a difference between your acceptance and rejections, especially when you're talking about D&V thesis. Right. So I've already told you about that. So a little bit about publishing your thesis. Let me quickly, tell you differences is, thesis has no word limit. You can write large or lengthy literature reviews. You can write detailed methods. You can have as many tables and figures as you want, but a manuscript has to be crisper, it has to be shorter. It has word limits, and it's better to answer one question in that manuscript, and you need to adhere to journal instructions, right? So you need to modify your thesis. You can perhaps sometimes have more than one publication from your thesis, and like you can talk about IOP, and then you can talk about say endothelial counts, and they can be 2 different papers, right? So different parts of the paper, we know these things, right? Introduction, review of literature, and lacuna. So what is known? So you need to really bring it down succinctly into 1 to 1.5 page of what is known, right? From your thesis of 7, 8, 9 pages, you need to bring it down to about a 1 page, 1 to 1.5 page. And the method section, who are the participants? Same as a PICO approach, but then it is far shorter, right? So what are the baseline tests? What are the interventions, follow-ups, and follow-ups too, and the outcomes? So you are basically just bringing down your thesis into a relatively smaller size, You can follow flow charts. So this is what this is what was done. This is inclusion criteria, exclusion. This was what was done, randomization, and there were 3 groups, day 1, day 7, etc. Right. So again here, so what is important is enrollment, intervention, and analysis. This is the key. These are all going to be different. So inclusion, exclusion, at one glance, your reviewer of your thesis can actually see this, right? So inclusion and exclusion, and then what was done, and then, how it was done, and, what analysis was done. Then your results, we start with the demographics and talk about the primary outcome first in your thesis as well as your manuscript, and make it relatively shorter, right? So for this topic, you will talk about IOP first, and then you will talk about vision, and then you will talk about other thickness and, endothelial counts and all of that, right? So primary outcome needs to be reported first. So for this glaucoma study, it has to be intraocular pressure. Many times you will read a paper where they start with, glaucoma, and then they'll say results vision is this, endothelial count is this, and then there will be one line, preoperative mean IOP reduced from the 33 to 18. And that's about it. But the primary outcome was IOP, right? We were talking about IOP and so many other things about IOP, but then that was lost somehow. So remember to concentrate on primary outcome, and discussion is pretty similar, but you have to again, sort of bring it down. Remember that abstract, also has to be, everything that you've done needs to be conveyed. So we can have a whole session on abstract writing as well, right? So remember that you as well as your thesis guide and biostatistician all play a very important role, and the statistician will play as much of a role, if not more. And if he is good or she is good, they'll actually help you. And the guide needs to be more than a guide, needs to be a mentor, and help you with all of these. And hopefully you will get good mentors. And if not, ask them to watch this video and get some perspectives on doing thesis, getting topics and other things. And so this is what I thought we'll start off with. So overall summary is: do a novel topic, take proper consents, and write your methods properly, use Excel, store your data well, perform analysis, send it to a statistician, get them back, write your results, obviously write the discussion well, comparing with others studies, and then thesis journal publication. So these are some courses which will teach you how to do all of these. So this is there on the Research Academy, my Sengupta Research Academy website, and you can all take a look at this. This is the I look slightly different from this image though. So I'm happy to take questions, and thanks so much for listening.
Thank you so much, sir. It was definitely a holistic approach for thesis and research, and I'm sure it will be helpful to all of us and postgraduates as well. So before we conclude, I have 2 questions. So I'll go ahead with that. And I would want to know if there are any free softwares available for any of the data analysis or so that could be helpful.
The best software which is available and is totally free is called R. Just the letter R. So
Okay.
R statistical software is it's even better than STADA. It's better than SP. Don't use SPSS. Please don't use SPSS, because everybody has a cracked version of SPSS, and every time you do an analysis, you will get a different p-value with those cracked versions. So you can't use SPSS, which are freely available. But what you can still do is use R. Problem with R is that syntax of R is not easy. The syntax, you need to tell R, right? This is what I want to do. So learning R syntax, you can do additional courses to learn how to use R. And now also you can actually ask ChatGPT for a particular syntax, and then you can copy paste it and then use it. Though it's not that easy. But first and foremost, you need to understand what tests I want to do. Do I want to do a t-test? Do I want to do a chi-square test, and whatever? So if you tell the software, it will actually help you. But if you don't know which test to use, then it becomes problematic. So couple of trainings are necessary. One is what tests and how to plan this analysis, which my academy teaches, and then the other is using of R, which we can also do a session maybe later on. But there are a lot of free courses on how to use R for analysis, so you can actually take a look at that. So R is really one very good software. It's all free.
Okay. All right. And the second question is regarding while submitting for high impact journals, pertaining to quality, what exactly, are there any few particular points they look for before accepting?
2 or 3 things. First is, the higher the journal, the more novel the paper has to be, right? So if you're submitting to Konya or you're submitting to a slightly lower ranked journal, the novelty is first and foremost. Second thing is the journal even interested in that? Say it's a study on prevalence of disease, but then say American journal doesn't even take epidemiology studies. They only want clinical studies. So or say your paper is on number of cataract surgeries and cataract blindness, but then JCRS, the journal, does not accept any of these. They only want clinical articles, surgery, and all of these. So so journal choice is again another detailed topic which we can spend more time on. But overall, journals want to see whether it's novel, and that's like it's really novel. And second and most importantly, is my readership interested in this? That's why it all really comes to the scope of the journal and how much impact it has and what its readership wants.
All right. So last one simple question, sir, because of the latest change of trends. Is only ChatGPT like we can ask about the syntax, or is there anything else like AI integration into research is still coming up?
So I have a LinkedIn post on this, and I have listed at least 10 softwares.
Okay.
You can take a look at some of those. But then freely available is ChatGPT. All of the others are paid ones. If you want to use ChatGPT, use the paid version. It's like hugely different, phenomenally different from the free version. So that, it's $20 a month. It's not that costly. It depends on how much you're going to use it, right? If you are just going to use it to say, is it hot? Is it going to be hot today? Then you can do it with the free version. But then, it makes sense to go for a paid version if you're actually going to use it far and more and more, or like all the time. So ChatGPT is one good one, but then for research purposes, especially, there are some software which will actually, you just tell that software, tell me a summary of all the papers published on corneal ulcer and intrastomal voriconazole, and it will actually list all of them reference wise and just hand it over to you. And there goes your review of literature. You have to write it at all, almost. Of course, you have to read it. And trust me, a lot of these make a lot of mistakes. They do make a lot of mistakes. So I asked one of those, tell me about vitrectomy in CRAO. And it told me about a paper which had just done paracentesis. And there was no vitrectomy arm at all in that study. And, when you read it, you will find it written so well, very smooth. You will not realize, but when you go and cross-check, you will say, oops, this is like a big lie. And it is said so smoothly that unless you are rechecking and checking again and again, it's also improving, right? But then, make sure when you use software, you are careful.
Okay. So Dr. Arvind sir wants to ask 2 more questions as well. So over to you, sir.
Yeah. So Dr. Sabyasachi, very exhaustive, and it was a near perfect presentation on this intriguing topic. So my question is, whenever PG is going for something new, right? So I will cite just example of this, that my PG applied for this thesis topic on our new drainage device in glaucoma. So that was not accepted because it would have been the world's first such head-to-head clinical trial.
Okay.
So how to counter these kind of questions, that there is no such study, so you cannot take it as a thesis topic?
Yeah. So, first and foremost is anything invasive like that has, let's not take this lightly, because anything invasive has ethical issues. And so first of all, we need to really prove that we are not experimenting too much. It's like we are not taking people for a ride. And so, if you have some pilot data, because, it's not that straight away we are going, because
Yes, we presented that 125 patients data, and it's already DCGI approved, CDSU approved.
So then it was rejected by the ethics committee, or?
Yeah,
what?
ethics committee.
Yeah. So then, it really is under the purview of the ethics committee. But generally, if it's a investigator initiated study, which is, there is no sponsor to it, then generally most ethics committee are okay with, unless, if they're rejecting, they can't just say, oh, previous study is not there and therefore we are rejecting. I don't think that is acceptable at all. And, there has to be an arbitration committee also, where, like large organizations like JIPMER and AIMS have arbitration committees where if you're not happy with what they're saying, you can actually go and tell them. And there is somebody sitting, who is vetoing their decisions. So arbitration committees are important sometimes in this. So, 2 main things is, if it's a investigator initiated study and that investigator doesn't have any conflict of interest in that product, then, it can actually be approved. But then if it's a sponsor investigation, sort of initiated study, that is, say a large
It
pharma
was
is
not
coming.
sponsored. No.
Yeah, so then, they need to give you a scientific reason of why it has been denied. If not, you have to look at arbitration committees, because it's not really under their purview to just reject it when the methodology is right and everything is okay. So, institutes generally, I mean, the proper institute should have a whole SOP saying what to do if you are not happy with the ethics committee, this thing. And, sometimes you can reapply with whatever changes are there. But then arbitration committee is, I think, the answer to that.
Okay. And now coming to the second question. So there are awful lot of theses are happening, but if you see the publications, I think they are less than 10%. So how we can improve on this aspect in India?
Yeah. I think first and foremost, it starts with the guide. And, we can't just blame students. So, I've repeated this plenty of times. There are no bad students. There are bad teachers. So whoever
Absolutely. Absolutely.
is listening later on, once you become teachers, remember that it's up to you. So the students, the best institutes will have 3 or 4 topics ready. And when the student comes, they will just allot it and save a lot of time. Instead of saying, oh, go and read this and tell me what, and then I'll choose. That is, as soon as you start that, that's it. It's the end of the road for the PG. That's it. They have no idea what is to be done. So who do you think the problem lies with? It's clearly the guides. And later on the guides say, oh, I need publications for my for my promotion and whatever that is.
Promotion.
Yeah, but then you are not at all putting the hard work. So I
Mm.
think focus is on the guides to improve publication rates. From the PG side, what, because people listening to us now are PGs. So from the PG side, what you can actually do is, follow all these things meticulously, where, you can actually do a literature review and say, oh, this has already been done too many times. I don't want to do this. And the guide should be open enough to say, okay, then what do you want to do? And so you can give them a little bit more time, and, hopefully they'll come up with topics. Also, I would say, putting a new glaucoma device as a thesis topic is perhaps not such a great idea, because it may be very novel, but then it's like too novel for the PG also to, sort of comprehend, because they are starting with, what is glaucoma, what is trabecular meshwork. I have no idea. I've never done a gonioscopy. So for them to do this is perhaps a little bit difficult. So, overall improvement is, from the guides perspective, a lot of measures need to be taken, and we need to have more sessions for guides than for PGs. And of course, from the PG's point of view, that intense desire is very, very crucial. And, there are too many riches to be had if you do your thesis well and you're able to do, proper research and publish, because, you name it. You want a fellowship, you will get it. You want an international placement, you will get it. You want to settle in Australia, you will get it. So whatever, even the United States is not closed totally. So, if you
Absolutely. Publish or perish.
yeah. So if you have, this is time to start. So even if you cannot place one incision, it is okay. But if you cannot publish papers, it's not okay. By 2030, you will realize what I'm saying, and we can have a whole session again on why I'm saying this. But then once AI comes in, you'll realize that, oops, I am now required only to monitor the AI. I'm not at all required to make decisions. I'm not required to even touch the patient, right? So, that's how it's going to be. So please take this very seriously, not just the students, but the thesis guides as well.
Thank you so very much.
Okay. So thank you, sir. Next, we'll meet on Wednesday, which is September 11th. So the topic for that day is the eye of the exam, a panel discussion by expert postgraduate examiners. So see you all on Wednesday, and a very happy Ganesh Chaturthi to everybody.
Happy Ganesh Chaturthi. Good night.
Good night. Thank you.